Amanda. My name's Callie Anderson. I'm going to be your physical therapist today. So, can you tell me what's going on?
So I've been having a lot of neck spasms lately. It's happened before. I've been training really hard I really want to be a competitive gymnast.
Alright, so, how long has this pain been going on, or this discomfort?
I would say close to 2 months or so.
2 months? Has this always been an issue, or has this just begun because of you trying to be a gymnast?
I think it's just, it started up again because I've increased my training a lot more, and it's really bothering me.
So, are you in pain right now?
Yeah, a little bit.
So on a scale from 0 to 10, 10 being absolutely horrible pain and 0 being no pain at all, where would you rate your pain?
I would say about a 3 or a 4.
About a 3 or a 4. And does it get worse when you're at the gym training, or is it just kind of about the same?
I would say more after practice because I just feel really tight.
All right. So before we even get started, I'm going to just take a few measurements, okay?
Okay.
So if you mind, will you just sit in this chair for me? All right. We're just going to, before we even take a measurement, I just want you to bring your head forward like this. Do you have any pain with that?
Mm-hmm.
How about backward?
Down a little bit.
A little bit. How about side to side?
Yeah.
Yeah. Okay. And then can you turn your head, look over each shoulder?
Yeah, it feels pretty tight.
Okay, pretty tight, but you'd say that this is the worst pain right here?
Mm-hmm.
Okay. So we're just going to take a quick measurement of that, if that's okay.
Mm-hmm.
All right, you go ahead and bend your head to the right for me. All right, and you can go ahead to the left. Yeah, it does seem like you're a little bit tight, so if you don't mind just sitting back up on the table for me. So when you went to your doctor about this problem, did he tell you anything about any certain movements that he didn't want you doing at all?
No.
Okay. And you said that this injury or this problem has been going on for about 2 months, right?
Yeah.
Okay. So I wouldn't say that you're hypermobile at all. You have some stiffness and stuff, so I don't think that's really an issue. And you said that you had used traction before for your problem. So did you ever notice any your symptoms getting worse, like the pain getting worse when you were using it?
No, it actually got a lot better afterwards.
Okay. And so real quick, I'm just going to take your blood pressure. Yep, that seems normal, so that's good. Just a few more questions, then we can get started. Have you ever been diagnosed with rheumatoid arthritis or osteoporosis? You don't have an infection or a tumor. Since we're doing cervical traction today, I don't think that I need to ask you about any belts around this area, if that could be hazardous. But did you have an MRI or an X-ray or a CT done before for this problem?
No.
No. Okay. Did your doctor mention anything about maybe having a medial disc protrusion or a displaced annular fragment? No. Have you had any recent surgeries lately? Nope. Okay. Did your pain does it get worse when you use traction?
It didn't last time.
It didn't last time? Okay. Are you okay laying on your back?
Mm-hmm.
All right. And have you ever noticed that you have any problems with your jaw? And you're pretty young, so I doubt that you have dentures. But so today I think we're going to use cervical traction, and that's because you're having some of those spasms in your neck. You can also use it when you're really hypomobile, so you can't get a lot of your basic movements with your neck. Also, we use it on when a nerve is impinged or you have a disc bulge, which none of that is anything that relates to you. We're just going to use it for the muscle spasm. And I'm going to ask you these questions again when we put you in the traction, but you never noticed any new symptoms after using traction before? Okay, and you said that your symptoms didn't really increase or get worse while using it. Okay. So if you don't mind, you can just go ahead and lay back, and we are going to put you in this machine. Okay. And try to get you better. Just lean back. There you go. There you go. Alright, I'm gonna tighten this, and I just want you to let me know when it gets uncomfortable. It doesn't look like you have any earrings in or anything. You want it to be tight but not uncomfortable or anything, okay? So how's your gymnastics training going?
It's going. I'm hoping to start competitions pretty soon, but this is kind of
Have you ever seen the movie Stick It?
I have.
Yeah, she seems pretty tough, so I can't even imagine what you're going through. Okay, so do you have any like skin irritation or anything that with like Velcro and it looks like your skin looks pretty good? So I'm gonna put this on your forehead just to be safe, all right? Just so no irritation occurs. Make sure that's nice and tight. All right, so because you have, since you're having spasming, we're gonna go ahead and keep this on 15 minutes because you've had traction before.
Okay.
But we are going to set it on where it is on for 5 seconds and then it goes off for 5 seconds, all right?
Okay.
Just because that's usually what we do for people that have like the spasming issues,
Mm-hmm.
all right? And so before I start this is a patient shut-off.
Okay.
I want you, if you start to feel any discomfort at all, I want you to click that. And if you just feel uncomfortable and feel like something needs to be adjusted, there's a bell right here too. So, everything seems good. All right, I'm just going to give this a little tug, make sure that this feels okay. Is that all right?
Mm-hmm.
All righty. So we are going to start this, and then in about 5 minutes, I'm going to come back and check on you, okay? Hi Amanda, so it's been 5 minutes. How are you feeling?
Good.
It doesn't look like your skin has become irritated or anything. Are you feeling like your pain has kind of completely gone away or your symptoms are like spreading at all?
No, it feels good.
Alright, well, you still have about 10 more minutes. I'll come back in just a little while to make sure that everything's going okay, and then the treatment will be over, alright?
Okay.
Alright, Amanda, it seems like your treatment is all over, so we are going to get you out of this, and we're going to reevaluate you, alright?
Okay.
Alright, you are more than welcome to sit back up. Alright, so, how's your pain right now?
It feels a lot better.
Feels a lot
actually.
better? That's good. Can you rate it again for me on the 0 to 10 scale?
I would probably say about 2.
About a 2? That's awesome. That is a decrease in what you were before. Do you mind sitting in that chair, and we're going to just reevaluate some of that motion that you were lacking a little bit. Alright, so go ahead and just bend to the right. Awesome. Alright. Go ahead, go to the left. That's great. Your motion decreased a little bit, which is really awesome. So you can go ahead and sit back up on the table. So as long as this pain continues and you keep feeling like those spasms are happening, I want you to keep coming to see me so that you can get some traction, because I feel like that will be very beneficial for you. So I think 2 times a week for the next 4 to 6 weeks will probably be what's best for you. And at home, you know, you can just do some strengthening exercises like chin tucks. And if you start to feel any more discomfort, don't be afraid to give me a call or give your physician a call. Okay?
Thank
Very
you.
nice to meet you, Amanda.
You too.